The Department of Nursing Education, Practice, and Research is pleased to be able to offer this training video on interprofessional clinical assessment, rounding, and evaluation. Icare. Icare rounding occurs in 3 phases: preparation, the rounding process, and documentation. Phase 1, preparation. At Grady, the Icare program coordinator reviews the admission database for high-risk patients daily. Patients are selected based on diagnosis and need.
Good morning, everybody. Oh, good morning, Miss Paula.
Hey, how are you doing?
I'm doing good, thank you.
Did you see that email about the Icare round at 2 o'clock?
I did. I'm actually getting ready to page the physician now, make sure he's available at that time.
All right. Well, keep me posted, okay?
Will do. Thank
See
you.
later.
Good morning, this is Rylan McDevitt. How can I help you? Oh, yes. Doctor, I was actually calling about your patient in 10-bed 2. I wanted to let you know that he's been selected to do our Icare rounds today. It's that new multidisciplinary meeting that we're having with the patient, and we scheduled it for 2 o'clock. Will you be able to come? Okay, very good. If anything comes up, give me a call. Otherwise, we'll see you then. Thank you. Good morning, Mr. Ryan. How are you doing, sir?
I'm fine. How about yourself?
Good. I just wanted to let you know, today you're actually going to be having a group of people come in and round on you. It's
Okay.
going to be lots of different medical professionals. There'll be about 5 or 6 of us in here.
Okay.
Somebody from pharmacy, from social work, from case management, myself as your nurse, and your medical team.
Okay.
And I don't want you to be alarmed or overwhelmed by it. It's actually something good for you. We're
Okay.
all going to be in the room together to talk about your discharge plan and any needs that you might have so that we can make sure you get discharged successfully from the hospital.
All right.
Do you have any questions about that?
Not right now. I'm just looking forward to getting home.
Okay, well that's the plan. We want to work with you to help you try to get you home and keep you there.
All right.
Okay, if you have any questions, give me a call. In the meantime, we're just going to go about our day as normal, and then everybody's planning to meet with you about 2 o'clock.
Okay. Is
Okay.
that soon?
In a few hours.
All right.
All right, thank
All
you,
right.
sir.
Thank you.
Phase 2, conducting rounds. Now that our team has been notified and the patient has been prepared, we are ready to round. In this next vignette, note that the team convenes outside the patient's room at the selected time. The team should discuss any patient-sensitive information before entering the patient room. This is especially important when the patient is in a semi-private room or has visitors.
So we're going to go in and see Mr. Ryan, and I already talked to him this morning and let him know that we are all going to be coming in, so he's looking forward to seeing us. I explained to him that it's just to make sure he's discharged successfully. As far as I know, I don't think there's any sensitive information that we need to discuss before we go in and see him. So when I go in, I'm just going to introduce myself, and then we'll go around and let you guys introduce yourselves as well, and then we'll get started. Okay.
Go.
Mr. Ryan? Just like we do all the time, I need you to confirm your date of birth and your full name, please.
John Ryan, 12567.
Okay, thank you, sir. All right, so we have Mr. Ryan. Mr. Ryan, this is the group I told you was going to be coming to see you today as part of our Icare rounds. I'm Rylan, your nurse.
I'm Titi, your case manager.
I'm Farrell, your pharmacist.
I'm Dr. Lopez with the primary team.
Okay, so we have Mr. Ryan. He's a 59-year-old male, and he was admitted for sepsis. Okay?
Yes.
Okay, so we're going to talk about you and your health care and how to discharge you home properly, okay?
Okay.
All right. So, Mr. Ryan, what would you like us to do for you while you're in the hospital?
I just want to get better. I need to get home and help my mom.
Okay, very good. And is there anything that we can do to make sure you get home successfully?
Just get me out of here.
Okay. Now, I know we talked about your pain earlier, and sometimes you have some pain every once in a while. On a scale of 0 to 10, what's your pain right now?
Probably a 4 or 5.
Okay. And I know yesterday your pain got up to an 8 and we gave you one of those Percocets. Did that work for you?
That did help.
Okay. And right now, do you feel like you need anything for pain?
Not right now, but maybe after a while, if you can check back in.
Definitely. And you know you can always call me on your phone or hit your nurse call light and let me know if it comes up when I'm not checking on you.
Okay.
Okay?
Okay.
All right. And I think the doctor was going to talk a little bit as well.
Okay, and I think that you were having trouble sleeping the other night.
Yeah, I didn't sleep well, and can you get me something to help me sleep?
So there's
And-
already ordered something called Benadryl, and you can just ask for it if you're having trouble sleeping at night. You can ask the nurse.
Okay.
Yes.
Did they give me one of those last night?
So I think I looked through the chart, and I think they did give you one last night. Did that help you?
Well, I don't know if I actually got one because I didn't sleep all that well.
Okay, well we can
Last
try
night.
again. We can try again tonight to make sure. And if not, I'll put another medication on there that can
Okay.
help you sleep if that's not working.
All right.
Okay.
Thank you.
And just so you know, Mr. Ryan, that's an as-needed medication. So I'll make sure I tell your night shift nurse tonight that you're going to need it. But if you can also help remember and ask for that when they bring you your bedtime medications.
Okay. Good.
I am your pharmacist. You're going to be discharged on some medications home. Do you have any questions about them? Are there any needs?
Yeah, the sleeping at night, I'm worried about that. Is that something that you can prescribe to me, or
Your
I can?
physician can prescribe something for you.
Okay.
So we can send you home on the same thing that seems to work for you here tonight. So let's see if the other medication works better, and then we can
Okay.
write a prescription for that.
Okay. What medication will that be?
So we can, if the Benadryl doesn't work, it could be something like Ambien, but let's just see what will work for you tonight.
Okay.
Okay, I'm Titi, your case manager, and I want to make sure that when you get home, you'll be able to come back and see the physician, and then all your needs will be met before you leave the hospital, like your medication, where you are going to stay,
Okay.
and your appointment.
Okay.
So when I discussed with you last time, you said you have a Grady card.
I do have a Grady card, but will that help pay for my medication?
Yeah, that will help to pay for your medications.
Okay.
And then when you come back to see the doctor, they will be able to give you the discounts to be able to go to the physician office.
Okay.
Yeah, and then
Will they give me a card, or how will they know that I can have that discount?
we don't have a physical card right now, but when you submitted all your information, it's already in the computer.
Okay.
So
So I
whenever
don't
the-
have to do anything?
You don't have to do anything. And then you told me earlier that you're going to need transportation home.
Yes.
So I will be able to set that up for you.
Okay.
And you say you're going to be staying with your mother?
Yes.
Okay. So if your plan changes, let me know. But
Okay.
we're going to work with this for now.
Okay, will you drive me home?
No, I'm going to get you the Grady van.
Okay.
Yeah, so far you are able to walk and do everything for yourself. We'll put you in the van and they will drop you in your house
Okay.
with no problem.
And then will they pick me up when I need to come back here, or how will I get back to the hospital?
If you need that, give me a call, then we'll be able to set up transportation for you.
Okay.
Yeah.
And just make sure for your follow-up appointments, you don't need that actual Grady card, but bring your picture ID to identify
okay.
yourself, and then they'll be able to pull up all the information from your hospital stay.
Okay.
And if you need medication, when you come back for your appointments, remember you can use our pharmacy to refill your medication on the same day, or you can call it the day before. So by the time you're here, you can pick them up on the same day. You won't have to make 2 trips.
Okay,
to this
that's good
institution.
to know. Thank you.
Okay, so did we meet all of your questions?
I think so.
Okay, is there anything else while you have everybody here in the same room that comes to mind?
I don't think so. I'm just ready to go home.
Okay, well,
Okay.
we want you to go home as well. That's why we have this meeting. If anything comes up, just let us know, because I can get in contact with all these people for you any day that you need it, okay?
All right.
All right.
And one more thing, if you need the transportation and I'm not there, you can call 54195-404-616-4195 for your transportation, and they will be able to assist you with that.
All right.
And what I can do is I can give you that number in your red discharge folder that
Okay.
we talked about when you were admitted. So we'll put all those important phone numbers in there with you so that you have them when you get home.
Okay.
Okay?
All right.
All right. Thank you, Mr. Ryan.
Thank
Thank
you.
you.
Wish you well.
Bye.
Very
Thank
nice
you.
meeting you.
Thank you.
Okay, so I think that went pretty well, and he seemed to respond to all of us being in there. I'm just going to go through the debriefing checklist. Do we think the communication was clear?
Yeah.
Okay, I agree. Do we think that our roles and responsibilities were understood?
Yeah.
I think we all addressed our areas. Any variances in care that we identified?
No, I have some questions we're going to discuss, but no.
Okay, and then I'm going to make sure that when we leave here that I update the care plan saying that we did the Icare rounds, so that'll be documented in his iPad. And then any takeaway needs to address the patient's goals?
No, can we just discuss the work console if you wish to continue that?
Yes, actually I spoke with ID about it, and I think we're going to discontinue the voriconazole. He doesn't have a proven diagnosis for aspergillosis, and we'll use fluconazole instead.
Thank you.
Thank you.
And then do we have any suggestions as to what we think went well?
Yeah, that was my last act. Scrambled.
And I'm thinking
Phase 3, documentation. At the completion of Icare rounds and debriefing, the primary nurse will update the patient's plan of care using the Icare template and document the patient's stated discharge goal. The nurse will have received all pregame playbooks and will include any relevant information from them into the plan of care. We have walked you through the 3-phase Icare rounding process. Let's review the key steps in each phase of rounds. Phase 1, preparation. Step 1, the Icare coordinator notifies the core team of selected patients. 2, the primary nurse makes reminder phone calls to ensure that all team members are aware of the time of rounds and have completed the pre-rounds playbook. 3, the primary care nurse will assess the patient at least 1 hour prior to rounds and share the time and participating team members. Patients' concerns and questions are solicited at this time. Phase 2, rounding. The team meets outside the patient's room prior to rounds. Sensitive information is discussed here. 2, the team makes rounds, making sure to form a caring U shape at the foot of the patient's bed. 3, immediately after rounds, the team debriefs. Phase 3, documentation. 1, each team member is expected to complete a pregame playbook. At the completion of the Icare rounds, the primary nurse will document any relevant information in the plan of care. 2, the RN updates the patient care plan using the Icare template and addresses any problems and/or goals.